Hi, my name is Dr. Beth Rhyne. I'm a veterinarian in Asheville, North Carolina at Charlotte Street Animal Hospital. And we're going to be doing some demonstrations today for physical rehabilitation. I am a certified canine physical rehabilitator, and I got my certification through University of Tennessee. Today we're going to give a demonstration on passive range of motion in various joints, and we're going to start with our rear leg. It's important when you're doing this to have some person helping to hold and restrain, and then the other person actually doing the range of motion. The animal should be on its side and completely flat on its side so that there's no type of uncomfortable twerking of the legs and the joints when we're trying to do the range of motion. The passive range of motion will be done for the purpose of increasing flexibility and decreasing pain, and it's going to improve comfort either after a soft tissue injury or with arthritis or with some other kind of orthopedic recovery. So what I usually like to do is start at the toes. Once we have the dog relaxed, then we'll start with pushing the toes up, which is going to be our extension, and pushing the toes down, which is our flexion. And you go towards the end point of where that dog is comfortable. Callie's a little bit nervous for us today. You go to the end point and hold for about a second or two, and then go to the other end point and hold for a second or two. And then you do this the number of repetitions that your doctor prescribes, concentrating just on those joints of the toes. My other hand is helping to stabilize this leg and keep the leg in an even plane with her body, so it's not too kinked up and it's not too far down. Once you've done the toes, then you'll move up to the ankle, also known as the tarsus. And again, we're going to flex the tarsus or bend the foot up, and then we'll also open the tarsus or extend open. So my hand here is helping to support. The other hand is helping to move the joint the way I want it to go. So we're flexing and then extending. You want to try to have this hand as close to the joint as possible. That's more comfortable for the dog. And then your other hand can be closer to the body. So flex and extend. Flex and extend. The next joint up is the knee, which is also known as the stifle. It's right here at the front part of the leg, fairly close to the body. And we're also going to isolate this by flexing or closing the joint. And then we're going to extend and open the joint. With this joint, I'm holding this hand underneath the knee for support, and then using my other hand to move the rest of the leg in the direction that I want. So this is flexion, and this is extension. And we'll keep doing this the number of times that your doctor recommends. The hip is even further up. This is a little bit more tricky. You can often palpate the hip bone, but you are going to just have to envision where the hip joint is. So this would be where our femur is, or the main leg bone, and then this is where the pelvis is. So this joint here is what we are opening and closing. So this is the flexion of the joint, and that's the extension. So for her, I'm going to put my hand over the hip joint, and then this other hand is going to raise the leg to close or flex the hip, and then I'll turn around and pull the hip down to open the joint or to extend the hip. So this is the stabilizing hand, and then the other hand is what's helping to move our leg. So this is flexion, and this is extension. Some people will also, when they're doing this, do a very fluid movement. This is called bicycling, and this is a little bit more active range of motion that all the joints are going through at the same time. Not the same as doing the passive range of motion for each individual joint, but it is a good way of connecting all of them together.
Okay, perfect. And we do have the size for a 67-pound dog.
And that concludes our hind limb passive range of motion.